Muscle strain is the most common source of back pain in children and adolescents. Symptoms of back pain that is caused by a muscle strain include pain in the center or lower portion of the back, pain that gets worse when bending forward or lifting up with some resistance in your hands. Muscles near the spine are tender to the touch, and they might be locked in spasm or tight. Most strained muscles will heal on their own over time, but there are some instances when you should contact a healthcare provider right away. When should I call a healthcare provider? In the case of any of the following, call a healthcare provider or seek care at your closest emergency department. Pain that's severe, pain that does not resolve within a week or two, pain that shoots from the back into the buttock or the back part of the thigh, tingling or numbness, a loss of sensation in the legs or feet, blood in the urine or pain when urinating, back pain that's accompanied by weakness or fever, loss of bowel or bladder function. What is a repetitive stress injury? Repetitive stress injuries are common in young athletes. When the body performs the same actions over and over again, the bones, joints, and muscles involved can become irritated and inflamed. Examples of repetitive stress injury are tiny tears in the muscle fibers, wear and tear on a tendon, or injury to the bone. In children, repetitive stress injuries often occur around growth plates, areas of new bone growth near the ends of bones. Growth plates allow a child's bones to lengthen as the child grows. Although rarely a result of repetitive stress injuries, if a growth plate is damaged, the bone may stop growing before it should, and this can become a serious problem and can change how the bone develops and functions. Seek care if you suspect your child has a repetitive stress injury. What are the signs of repetitive stress injury? Repetitive stress injuries can be tricky to diagnose because the signs can be subtle. Here are some things to watch out for: pain with activity, swelling, limping, a limited range of motion, pain that lasts for a week or more after an injury or gets worse over time. What are the most common types of repetitive stress injury? Little league elbow or little league shoulder is pain in the elbow or shoulder area, usually caused by repetitive overhead throwing motions, particularly baseball pitching, that cause damage and inflammation in the growth plates of the bones in the arm. Shin splints is a non-specific term that describes pain and tenderness over the shin area. Shin splints are caused by excessive running on hard surfaces, and improper footwear. Spondylolysis is a stress fracture in the lower back, and spondylolysis is caused by excessive or repetitive extension or bending backward of the lower spine. It's commonly seen in football linemen, gymnasts, and figure skaters, among others. Swimmer's shoulder is, again, a non-specific term that refers to several injuries that develop through repeated stress on the tendons, ligaments, and bones around the shoulder, causing irritation to develop in those tissues. Can repetitive stress injuries be prevented? One of the likely reasons repetitive stress injuries have been increasing is that more young children are focusing on just one sport earlier in their lives. The American Academy of Pediatrics recommends that children don't specialize in a sport until they're older than 15 or 16 years old. Encourage your child to try a variety of sports and activities to reduce the likelihood of overuse. Encouraging your child to warm up properly before activities is also important. Expectations for training shouldn't be increased more than 10% per week. That means weight, pace, or distance should increase gradually. And finally, make sure your child takes at least one day off a week from organized physical activity. Ideally, they should also take 3 months off of training for their main sport. And during that time, they may participate in other sports or cross-train. From first conversations to treatment, Boston Children's Hospital is committed to keeping children and adolescents healthy. For more information on repetitive stress injuries, please speak with your child's primary care provider or visit bostonchildrens.org.